In Germany, where we're joined by the president of the Nigerian Medical Association in Germany, Dr. Al-Amin Dairu. He joins us via Skype. Good evening, Dr. Dairu. Thank you for your time.
Hello, good evening. Thank you for having me.
Let's begin by asking you, how does exemption work for those on essential duties in Germany?
Well, I must really say that when the COVID-19 virus started in the beginning, the most important thing the German government did was to protect the vulnerable people. And when I say vulnerable people, I mean the healthcare workers and also all people who are not capable of helping themselves, who are directly vulnerable to the infection. So healthcare workers are protected in the sense that the PPEs, the equipment they need, were immediately supplied. Most of them were given written letters, permissions to take home in case anything happens. Even if they have to come back to the hospital and stopped by the police, they have a pass. So virtually all the hospital, all the health workers who are required to be in the hospital during this pandemic have a pass. So this pass will allow you to drive all the way to the hospital without having any problem from the police.
In Germany, about 178,000, just over 178,000 confirmed cases, but also a very, very high number of recoveries, 156,966 recoveries. What's been the situation like? How have you, as medical personnel, coped with COVID-19 in Germany?
Well, in Germany, I must say the German government was really quick to react. Quick to react in the sense that it started testing the population very quickly, very early. The vulnerable people, especially the old people, have been isolated. Here in Germany, they have nursing homes. They were taken to the nursing homes, and all the other ones who are not able to help themselves are being kept at home. So that means the infection on those who are really vulnerable and who might have severe infection to the extent of death are not given the chance to be exposed. So Germany has a very high number of middle-aged patients with this infection. And these middle-aged patients have high immunity, high immune system, which helps them to recover from this infection very quickly without going into severe cases. So that means the recovery is very high in the case that the patients are all middle-aged patients. We have very few old patients who might not have survived the disease.
What lessons do you think there are in the German experience that Nigeria could take in its own battle? We've got a fraction of the number of cases Germany has had so far. As a consequence of that, of course, we've got a fraction of the recoveries, a fraction of the deaths, a fraction of virtually everything. Yet there are more Nigerians than there are Germans. What are the lessons that we can take from the German experience?
Yeah. Well, I will not compare the German medical system or the German system with the Nigerian system. Yeah. So indirectly, I will not compare a developed country with a developing country. Yeah. The system are different. I must commend the NCDC. They're really doing a good job. But most importantly, what the Germans did is they kept testing everyone. They test. Whenever you come to the hospital with even mild symptoms, you get tested. I'll give you a good example. After the curfew was reduced, we started operating patients. So a patient came to our hospital who was completely asymptomatic. He was not having any symptom, and we were supposed to operate on him. So at the first instance, we got in contact with this patient. We took the history, did investigations and everything, and we did the COVID test. And this patient came out to be positive. So in this case, because this patient is positive, all the contacts he had to go on quarantine. So one of the things that is missing in our country, in Nigeria, is the discipline. If we say quarantine, most of the colleagues who were in quarantine had to stay at home for 14 days. They don't go out. They don't just go out, oh, I'm alone at home, okay, let me just go out and pass this. No, they stay, they make sure they spend 14 days in quarantine, and then they come out later. So generally, testing of the patient, community awareness. Community awareness is really important. Most of us in Nigeria, they only heard of the disease, but they don't know what it's all about. But it's real, Secondly, the COVID infection or the COVID-19 is not really, I feel the Nigerian government or the NCDC should not really focus on this COVID-19. They should also remember there are other diseases. There's hypertension, there's diabetes, there are people with kidney failures, there are people who are really sick who need to see doctors. Yeah, so the concentration should not be completely based on COVID-19 because the recovery rate is very high. It's very good, but the other diseases which people are suffering from in Nigeria should also be tagged along. They should be allowed to see doctors in time. So all these are things that Germany did. And the German people, their law abidance is when you say stay at home, most of them stayed at home. I'll tell you to an extent that the German government, immediately after the isolation, when the people were told to quarantine, German people were getting paid. That is small companies.
Indeed, we seem to be having some network issues with Dr. Dahiru's connection there. Dr. Al-Amin Dahiru, the president of the Nigerian Medical Association in Germany, joined us from Bielefeld in that country.